It's a good question. Peyronie's disease is one of those areas where there's not a lot of novelty or new things that come out on a regular basis. But there recently was published a new protocol which looks at a very aggressive technique in administering Xiaflex for Peyronie's disease. Now, Xiaflex has been out for roughly 8 years at this point, but this new protocol uses aggressive traction, aggressive stretching, and changes up the dose a little bit, and it shows almost a 2-fold greater improvement in overall outcomes. Another thing that's become increasingly popular over the past couple of years is something called extratunical grafting. This is used to address things like hourglass deformity, indentation, or other things like that. And it's really been pretty remarkable. As the data started to come back on some of these men who've undergone these surgeries, we're starting to see improvements in these deformities, which are otherwise very difficult to treat. There are a couple things that are heavily advertised out there, but that really haven't shown any additional benefits. So that's kind of new-ish in Peyronie's disease. Things such as shockwave therapy, for example, have really been around for nearly 40 years, but they're increasingly advertised, so they're kind of in the public's mind. But that also still hasn't shown any improvements as far as curve's concerned. The other kind of notable change is that intralesional interferon is no longer available. The company which makes the drug discontinued it, so you can no longer use it for treatment. It was an excellent drug previously to improve pain, but it's no longer available at this point.
The good news is we now have very effective, minimally invasive treatment for the vast majority of men. And I think that's really important because even today, even with all the ads on TV, most men who have Peyronie's disease never seek medical care. They often just wonder, boy, I hope it's not cancer. It's affecting their sexual life. It's affecting their personal relationships. So go see your doctor. They'll tell you about some of the new non-invasive treatments. And for most men, it can be effectively managed.